Our title today is Making Sense of the Complexities of Trauma, and this is Heather Hartman-Hall coming at you. And I want to cover several things today, but mostly what I'm hoping is that you will come away with some new tools to use in your work, maybe some new understanding you can bring to working with a client that's struggling with issues related to trauma. We're going to go through several things today related to understanding trauma syndromes, assessing them, and then planning treatment, as well as also looking at clinician self-care. So those stages of trauma treatment that I referenced earlier, this is, I'd say, the prevalent strategy that most people in the trauma field endorse. It's well, I think, described by many different authors. There's just a few here that I would encourage you to look at who have talked about these stages and how to implement them in treatment. They all talk about them slightly differently, so I'm going to use different terminology probably each time I talk about each stage. But the main idea is that there are 3 stages. And of course, like any stage model, these aren't nice, clear, discrete stages, and people don't always go through them in a nice linear fashion. Sometimes you start one, and then you have to go back to the one before. Sometimes you skip ahead a little and end up going back. It can get messy, but this is, I think, a nice roadmap. And it's helpful. I also use this with clients to explain to them my strategy for treatment and how we're going to go through treatment. The first stage would focus on safety and establishing the therapeutic relationship. The second phase is the memory processing and mourning. So this is where you do get into some of the re-experiencing, the exposure, some of that work. And then the third phase would be reconnection. After doing that trauma work, how do you begin to then integrate that back into their everyday life and better functioning? So let's look at each of those in more detail. Stage 1, which I usually call the safety stage, some people call it the stabilization phase. This is where you're really trying to manage the symptoms that are interfering with the person's functioning, including those that are comorbid, maybe not directly the PTSD symptoms or the complex PTSD symptoms, but also comorbid things like substance abuse, eating disorders, severe mood disorders, whatever else needs to be managed. And that's the focus of this stage, is getting some of those symptoms under better control so the person can function better and be in less distress. You're also working on motivation for treatment, keeping the person motivated, addressing anything that's a barrier to moving forward in treatment. And you're really attending to the therapeutic relationship in this stage. So building that collaborative alliance, building hope and trust. And as I mentioned before, along the way, you're doing a lot of psychoeducation to help the client understand how you conceptualize their problems and what you're trying to do about them in treatment.